It started maybe a decade ago, and I found that when I'd eat a pastry in the morning, I'd take a sip of coffee behind it, it would choke me. Like it would actually get caught here. Saliva would pool in my throat, and then I would choke on it. My sleep was completely disrupted by this. So I said, okay, I gotta go see a doctor. They found that there was a closing of the esophagus, and I guess the condition is called achalasia.
Basically, he can't swallow. So the stomach is normal, the lining is normal. There's no lumps or masses or strictures. It's just not relaxing, and that's why he can't eat. This procedure, which is called POEM, or peroral endoscopic myotomy, is a new endoscopic technique. It's basically surgery through the endoscope. What we're able to do is pass small knives through the channel to cut a layer of muscle that's actually causing these patients' disease. Everything starts within the body, within the esophagus. We tunnel through the esophagus, come back out through the same hole, and instead of having a laceration inside your skin, it's typically a 1 centimeter cut, just big enough for the scope that we're sealing up on the inside. We've been training for this procedure for years. Working with our colleagues in Calgary, we've been able to come up with a provincial group, and in both cities, we're able to do it as a combined unit.
The thing that's really captivating for patients is that there's no incisions from the outside. Everything is done through the mouth. Patients tend to recover a bit quicker. There's no injury to the musculature of the abdominal wall that would cause discomfort or pain after.
I can't say enough about the recovery because I could never have imagined, honestly, in my wildest dreams, it's like the stuff of sci-fi.
This technique is obviously one condition, but it's opening up the doorway for how we think about treating patients. So instead of just surgery or endoscopy, what is the blend? And I think between those fields, we're basically maximizing, what's the best way to treat these patients.
When I was reintroduced to regular foods, I felt it was night and day. It was a light switch that was turned on. I was now able to eat the foods that I enjoyed. Family sits around a dinner table or a gathering. I'm not worried about making other people anxious about choking or feeling discomfort. In a lot of ways, I've kind of returned to normal. So it's an incredibly exciting thing for me, yeah.